think Congress ought to pass anything that they don't read. I don't care how good it is. If you hadn't read it, you ought not to vote for it. So, and next, it ought to be their job to read it. And if they haven't, then they ought to be removed from office. They're being asked to pass extremely impactful legislation without reading it. I mean, that just boggles my mind. I am I'm against socialized medicine. I truly am. And
do you consider this socialized medicine?
Oh, yes, I consider it socialized medicine. Yes, I do.
So are you in favor? You're not in favor of a government-funded public option?
Well, here's what I am in favor of, and I don't know what label you put on it. Burton Jones and his administration, a lot of health care agencies and health insurance companies left the state. And we were supposed to have one or two that were going to combine into a big pool, and everybody was going to be saved by that. It didn't work. But the health insurance companies have not come back into the state of Kentucky. So what I'd like to do is I'd like to invite in every health care insurance company into the state of Kentucky and compete heavily with each other to try to sell us the most affordable health care insurance policy we possibly can get. And some people can afford more and other people can afford less. But I think then after that everybody ought to have a $1,000 deductible for catastrophic health insurance. I mean, everybody, even the poorest person has catastrophic health insurance, and if they get something catastrophic beyond $1,000 deductible, that they're covered from that. But, and the state has to subsidize that $1,000 deductible, on a copay for those people. I think they ought to, but, you've got to pay something when you go to the hospital, otherwise they're going to be overwhelming the emergency rooms with the hanging angels. You've got to have $5 or $10 to make them say, is that worth me going to the emergency room over, And then what I would do is fully fund the county health departments as a safety net measure. We've forgotten the county health departments. We're underfunding them. They're our first line against any pandemics. They're the line for community education. They're for vaccinations. And, I believe that they have a function to serve. So I guess I'm going back to the kinds of principles and kinds of templates that made this country great to begin with. I just don't trust government in health care.